My name is Jerry Whelan. I'm the National Sales Manager for miTRAX. Today, I'd like to introduce you to miTRAX. miTRAX uses a procedure timeline to enhance your patient education by delivering the content you want the patient to see when you want them to see it. The system delivers the content consistently to every patient and tracks their interaction with that content. It also reminds them if an assignment becomes overdue. All of this is done without using any staff time. miTRAX also delivers timely messages and survey questions and monitors a patient's response to keep that patient engaged, satisfied, and compliant. All of this is done without using any additional resources, allowing you to see more patients, meet current mandates, and have more free time. The landscape of healthcare is changing. As expenses mount and reimbursement rules change, healthcare providers are looking for ways to operate more efficiently. The U.S. healthcare system is moving from volume to value-based care, spurred by widespread efforts to control costs and improve outcomes. Consumers are impacting the healthcare market using their increased purchasing power and access to information to drive healthcare decisions. Providers need to identify and employ innovative ways to satisfy the needs of these consumers. Consolidation, mergers and acquisitions, joint ventures, and affiliations have become much more attractive as providers seek to build scale and manage cost. With the shift to value-based care, providers are looking for ways to differentiate their offerings through innovation. And finally, healthcare reform-related programs such as accountable care organizations and bundled payments have accelerated. Increasingly, providers will have to evaluate their risk acceptance for cost savings and patient outcomes. miTRAX is the leading provider of content and data that is automatically captured and tracked over a continuum of care to support the new outcomes-based reimbursement models and stay compliant with electronic health systems and meaningful use requirements. Additionally, miTRAX provides meaningful real-time provider and patient data that stimulates a dual responsibility for the patient experience and outcome. When processes are automated with miTRAX, they become consistent, efficient, and scalable. miTRAX, improving outcomes one patient at a time. Using interactive software, healthcare providers and patients create an accountability around a managed care approach to medically necessary procedures. Starting with the first point of contact, a healthcare provider will use miTRAX to educate, interact, and coordinate with patients prior to a procedure using the patient's mobile device. Healthcare providers now have the opportunity to deliver a range of information such as video introductions of healthcare providers, video descriptions of a procedure, documents, and other relevant information that all works to help put a patient's mind at ease around their procedure. Healthcare is changing. Patient engagement, education, and empowerment are all at the core of new delivery models, and providers are seeking new and innovative ways to reduce costs while improving patient outcomes. miTRAX is a technological solution that's designed to reduce healthcare costs and improve outcomes and experiences. Let's take a look at miTRAX. The reason miTRAX works is because it was built to be easy for your patient to use. Once the patient is registered, they log on using their phone number and a PIN to complete assignments and review materials designed to assist them during their procedure. Tasks are assigned to the patient based on the procedure and any custom implementation requirements from the providers. Each assignment must be completed by the due date. We're going to select a pain level survey to complete. And you can see, again, a very simple, user-friendly interface allowing the patient to provide information back to their providers so that everyone has all the information they need to be successful. Physical therapy exercises that are assigned to the patient appear with instructions and examples, and in this case, videos that support the patient's progress through the procedure. Now, the timeline of these assignments is based on the procedure associated with the patient. The library provides approved information, that is information that the provider decides is appropriate for the patient to see during this procedure. We have a number of documents that are associated with this particular procedure, and we also have a number of videos that are associated with this procedure. All of those are associated with the timeline based on the specific instructions. Again, healthcare is changing in so many ways. The relationships, responsibilities, expectations, and the demands have been altered and are changing very fast. miTRAX can help you deliver healthcare in the way that works for you. We can bridge gaps to improve levels of care while at the same time containing costs. miTRAX connects patients and providers using innovative technology and proven processes. We briefly reviewed the patient miTRAX application. Now let's look at what our providers see. From the dashboard, providers can see alerts that have been assigned to them. These alerts and notifications can be managed within miTRAX or automatically passed to your patient management system. We're able to see the alert that was selected for us for this patient. At this point, I can complete the item, or I'm also able to reassign this to an authorized user associated with this patient. I also have the ability to add notes that'll become a permanent part of this patient's record. One of the compelling aspects of miTRAX is that we're able to see all of the patient's interactions with miTRAX. We know when they viewed a document, when they watched a video, or when they completed one of their assignments. This is invaluable information around creating that mutual accountability of care. The to-dos show us the calendar view of the selected protocol for this patient. At a glance, we're able to see all of the tasks, all of the activities that we've asked this patient to perform for us. Finally, we have the ability to provide graphs and tables that show the results, in this case of our pain level survey, or of any other surveys that we're asking the patient to complete for us. We'll briefly take a look at the template procedure that we've been viewing with our patient. In this case, we have a standard protocol or a template that has all of the tasks associated with this procedure, in this case, a total knee replacement. We have the ability to customize these templates based on the specific needs of a group, an individual physician, or even a particular patient. We know that that's a critical point in offering the level of care that is expected of our patients. In this case, we have a pain level survey. We reviewed this as we were looking at the miTRAX patient application. We're able to set specific tolerances when we alert providers based on the responses that we receive back from the patient. In this case, we've set our danger level at greater than or equal to 8. Hurts a whole lot. At that point, we're going to notify members of our team to take some action. We have the ability also, based on the responses that we receive, to prompt alerts to other members of our team. miTRAX gives providers access to real-time patient data to better understand that patient and any factors that might affect the outcome. Handoffs to other provider team members create a seamless continuum of care. With miTRAX, the post-procedure process is enhanced with on-point education, tracking of follow-up, and relevant information to that procedure. Post-procedure follow-ups are enhanced, automated, and tracked to improve the level of care and timeliness of an intervention when needed. In short, providers have more time for patients. The power of miTRAX really shines during the post-care phase of a procedure. From discharge information, physical therapy exercises, real-time patient surveys, miTRAX, with its vast library, can be customized for each patient's care. Providers are notified when appropriate throughout the recovery process, driving down costs with fewer return visits and minimal hospital readmissions. The goal of miTRAX is to improve patient outcomes, increase provider throughput, and grow the profitability of your practice by streamlining the provider-patient relationship and sharing the accountability of a patient's successful recovery. miTRAX integrates with your existing EHR or other back-end system, minimizing the number of systems that your team needs to know. Improved care levels result in higher levels of patient satisfaction, outcomes, and reimbursements. With better data and insight, providers can now improve the way that they manage patient engagement and make better decisions about ways to improve the processes and outcomes. When miTRAX is deployed, everyone wins. Providers have the data to be more reactive and improve care levels, all the while containing costs and gaining more time for patients. Patients experience better care and they're more satisfied. We'd love to hear from you. If you have any questions, please contact us at info@mitrax.com or visit our site, mitrax.com. I want to thank everyone for coming today, and we will be providing additional webinars on new topics for miTRAX. Again, thanks everybody for your attendance today.